Hello, everyone. My name is Nwabukwu. I'm the president and the founder for the African Women's Cancer Awareness Association. This morning, I'm here with my colleagues to discuss all the things that the organization is doing at this point in time. And so I'd like to start by saying that the African Women's Cancer Awareness Association was founded in 2004 in order to address the disparities in equity over awareness, prevention, and treatment, and access to quality health care for African immigrant women and their families, especially those who are diagnosed or suffer from breast cancer. Over the years, this organization has been there making sure that African immigrant women are educated and that they have access to early screening in order to be able to prevent, or if one diagnosed with breast cancer, have access to treatment. And so we can proudly say that we have been open and have been an organization that the African immigrant women can trust. We screen at least 30 to 60 women every year. And when they are diagnosed, we make sure that we provide psychosocial and support that they need, from treatment all the way to survivorship. However, due to the pandemic, this organization has been able to switch gears to also continue attending to our targeted population on meeting the needs of the coronavirus. We have been able over the past year to provide PPEs, conduct and provide webinars that deal with mental health of our targeted population, and also making sure that these women, despite the fact that they have breast cancers, they are already immunocompromised, that we work with them to ensure that they maintain their health. And so we have had a couple of grants that have allowed us to work with our targeted population. At this point, I would like to introduce you to one of my colleagues, Mr. Chris Chukwunyere Njoku, to continue this discussion about the new CDC grant that the organization is working with. Mr. Chris Chukwunyere, please continue.
Thank you, Ms. Ifi, for that introduction. Hello, everyone. My name is Chris Chukwunyere, and I'm the communications manager for AWCAA under the CDC Foundation project. It's been a wonderful time or an interesting time in the history of AWCAA because we've been intervening in terms of serving our communities in the area of breast cancer. But because of the pandemic, we've been able to veer into serving our communities by carrying out COVID-19 intervention projects. And in the past 1 year, we've been able to actually carry out 3 COVID-19 intervention projects in serving our African immigrant communities. And on the CDC Foundation project that we are currently implementing, we are focusing on increasing influenza and COVID-19 knowledge, confidence, and uptake among African immigrant communities in the DMV area. We actually have seen from records and from statistics that the Black community has been hesitant in terms of participating in the vaccination program. So this intervention program is actually very timely because we are trying to see how we can reach out to our communities and ensure that they participate in the vaccination program. And so we have several objectives that we want to use to achieve this goal. And one of it is to train and build local technical capacity to promote vaccine acceptance. And how we want to do this is to be able to train selected 40 local messengers who would serve as ambassadors in their communities to carry out, in conjunction with us, community outreaches to be able to reach out to their communities and talk to them about the importance of vaccination, and to also ensure that we create demand in the area of vaccination and get people to actually go up and take up the vaccines. So also, one of the ways that we also try to do this is also to conduct educational campaigns to promote access to correct information, because we know that it is information that helps people to actually take informed decisions. So through social media platforms, through community outreaches, through webinars, we are committed to ensure that we actually educate people, inform them about the need for COVID-19 vaccine acceptance. And also, we are also particular about providing psychosocial support to our communities, because the impact of COVID-19 is on everyone. We all are experiencing it. So there's need for us to protect our mental health, to be able to provide that psychosocial support. So we are also educating people, we are talking about it, we are conducting educational sessions, webinars, and we're using this opportunity to also debunk some of the myths and misconceptions about COVID-19, about mental health, to also create a culture of where people can actually talk about these things. Because among the African community, there's a culture of silence when it comes to mental health issues. So we want to try as much as we can to break that limitation. And one of the culturally appropriate ways that we've tried to actually develop some of these educational materials is to be able to look at them within the context of the African community and see how we can develop something that is culturally acceptable, that is linguistically sensitive and appropriate as well. And then we're also working to translate these materials into Amharic, into French, and also into Arabic. So these are the three major African languages that we are trying to that we will translate some of these educational materials into. And also, one other thing that we are also big at is collaboration. We don't do things in isolation, because we believe that with collaboration, we can actually have access to a lot more people. And so we are collaborating and supporting, working with public health institutions and government agencies to expand the reach of this vaccination program. So how we intend to do this is to work with health institutions like DC Health, like Maryland Department of Health, like Howard University Hospital, to be able to facilitate the process of vaccination. So what we try to do is to get this vaccination to the doorsteps of these communities. For instance, if you're working with churches, what we do is that we facilitate the process of getting this vaccination site at these churches where the people can actually take the vaccines. Now, what this means is that we are breaking the barrier of transportation, or we are reducing or removing the barriers of, for instance, transportation that a lot of African people experience. Also, we would at such sites provide interpretation services for these communities. That way, we are also breaking down the language barrier. This way, we're able to help people to actually access these vaccines. And we're really excited about the outcomes that we're hoping to get and we're hoping to achieve through this project. And we look forward to serving our community to the best of our ability. So I'm going to be handing over to Helen, my colleague, to share a lot more insight into this project.
Thank you, Chris. My name is Hellen Fissihaie. I'm the project manager, program manager for AWCAA under the CDC Foundation grants. As Chris and Ms. Effie broke down, a little bit more about who the organization is, what this overall concept is in terms of what the CDC is trying to focus on and the methodologies that we're going through. I just kind of want to summarize that over the years, influenza has become a national threat, both not just as a public health concern, but also as an economic concern, right? So the Center for Disease Control and Prevention estimates that influenza has resulted in between 9 to 45 million illnesses, 140,000 to 810 hospitalizations, and 12,000 to 61,000 annually since 2010. Incidentally, the emergence of COVID-19 actually exposed this high level of inequity that currently exists among racial and ethnic minorities, specifically the African diaspora and immigrant population. This has resulted, obviously, in what we've seen in high morbidities and high mortalities, as well as greater and unfavorable socioeconomic outcomes that we've all been impacted in one way or another. And we all recognize that the deeper the disappropriate impact of these disparities, so the higher lack of trust in vaccination programs, and consequently, it increases vaccine hesitation, especially amongst our population. Having identified all of these kind of factors, this project is really focused on: one, increasing influenza and COVID-19 vaccine knowledge; two, increasing the confidence and uptake amongst African immigrant communities in the DMV. And so for us, we're excited to partner with CDC to work on both the long-term and the short-term outcomes. And I'd like to go over those outcomes and ways that you guys can collaborate with us. So our focus really in short-term and long-term is, one, to increase the range of trusted community voices supporting vaccine education and delivery; two, to increase the availability of population-specific cultural competence messages; three, increase the number and diversity of vaccination-related opportunities in our communities, specifically who are experiencing the different disparities; four, increase the number and range of partnerships and collaborations between both health providers and community organizations; and five, increasing the number and range of health providers recommending COVID-19 and vaccine to patients, right? So there's a number of ways that you guys can collaborate with us. So as Chris mentioned, we're actually conducting ambassador trainings, which are community messengers, individuals who are active in their communities, who can serve as ambassadors to talk and educate about what's going on with COVID, vaccines, influenza, and all of these matters. You'll be educated, you'll be prepped to go out and educate your community. On the other hand, if you are part of a larger organization, your organization can also take part in this training and become a community partner with us. So we'll do the same thing. We'll also go through a training model with you guys and help you get prepared to be able to serve your constituency better. As well as we're looking for content creators and influencers in the community who are active and want to take part in this. There's so many different ways that we can engage and collaborate with you. On the other hand, if you are a health provider or a medical institution, whether you're a university or you're a hospital or a clinic, we'd love to collaborate with you as well in terms of not just getting the education, but also getting the referral, collaborating on events in order to actually bring communities together so that they can get vaccinated, so they can get educated and prepared to be able to live through this pandemic that we're currently experiencing. On the other hand, we're also always looking for volunteers who are interested in supporting this program. So if you have an interest in volunteering with us, please reach out, let us know. The email for reach out will also be included in this video. So make sure that you look out for that, but also go to the website and read more about the organization, email us, contact us. If there's other ways that you would like to collaborate, this is an exciting opportunity to serve at the forefront of community health. And we're excited to partner with CDC Foundation to be able to educate and support our community to make sure that these disparities are reduced and that we're able to make the type of impact. If you have any questions, feel free to reach out to any one of us. Our emails will all be available, as well as the organizational email on any documents that this link and this webinar are provided with. We're easy to access. And that's it. And if anyone has questions, again, please contact us. Thank you.
Thank you.
Right,
We look
thank you.
forward to partnering or collaborating with you all. And we hope you have enjoyed this recording. Thank you.
Thank you, everyone.